All right. So hopefully we got a chance. I know some of us were joining a little bit later, but I really want to kind of get to the meat and potatoes of today. Today, let's take a look at what our topic's going to be X-ray analysis. So we're going to look at a couple different X-rays and try to figure out what's wrong. So we're trying to diagnose. The main things that we're going to diagnose today are fractures and dislocations. So fractures and dislocations. Fractures are another term for a broken bone. So if you have a fractured rib, you have a broken rib. So just out of curiosity, you guys can use the chat or you can say it. What do you think is going to be the hardest bone in your body to break? So what would be the hardest bone in your body to break? Your leg? Yeah. Your jaw? Okay. So yeah, your leg, your femur, the top part of your leg is one of the strongest bones in your body. Your jaw kind of has an odd shape to it. Your skull, and I agree, the skull's job is to protect, right? So it has to do a pretty good job of protecting. So all those are pretty good answers. I can see all of them. On the opposite end, right? What would be the easiest bone for you to break? So like, what do you think if you worked in a doctor's office? What would you see a lot of broken? You'd see a lot of broken what? Arms, fingers, yeah, pinky finger, yeah. Because we can think like the fingers are. We can imagine a lot of ways that they could bend the wrong way. Broken ankles, right? If you say you jump off something high, your ankles take all that stress. So those are mainly the areas that we move and have interactions with other parts. So yeah, and that's what we typically think of. If you think of someone with a cast, you can think of people with casts on their arms or legs, their fingers, all that stuff. Yeah. So yeah, these are good, and these are kind of things to consider. The toes as well. Yeah. So some of your bones in your body are made up of different shapes, which make them a little bit harder to break, or some are thicker than others. So those tiny little thin bones, especially towards the end, are at a higher risk of what we call fractures or breaking. So for today, there's going to be a lot of reading. We're going to preview this together. So one of the most interesting things I think is X-rays have been around since 1895. Just to give you context, that's before cars became widespread. So when they used to take X-ray machines into the battlefield, because this was for it was the Prussian War, England and Prussia, I think, the Crimean War. Thank you. There it was. So in the 1890s, there was X-ray machines that were linked up to horse-drawn carriages. So we had X-rays more widespread than the car at one point, which is kind of crazy. We had X-rays before we had antibiotics. So we think that antibiotics didn't really come out until like after World War I. So it's kind of interesting to think about when things came out in history, right? So we're all kind of familiar with this idea of X-rays, right? X-rays are waves that are able to pass through your body, and what we see is the bones. So X-rays are able to pass through all of the other tissue except for bones. Healthy people get X-rays all the time. What's one place you may get an X-ray if you, without having an injury? So what's one place that you may get an X-ray without being injured? I have to go in like 2 weeks, 3 weeks. Some of you guys, you should get one at least once a year. So they have, for your brain, you can get MRI scans, which are a little bit different. Usually we would scan someone, we get a CT scan if you had a car accident, your chest, yeah. So those we might do for healthy people, but the problem is X-rays are kind of damaging. What I was thinking more of is dental office, right? When you go get your teeth done, typically they take X-rays of your teeth, right? To kind of see if you have any cavities. They try to look at the bone. And so they put those big, heavy lead vests on you to help protect your body against that radiation, because that radiation goes straight through all of your cells And if it hits the nucleus and messes with the DNA, you can cause mutations. And if you have too many mutations or you're too exposed to it, so you getting a chest x-ray or going and getting an x-ray at the doctor's office, you're probably going to be fine. It's the people that work at that office that give x-rays every single day that really have to be careful because they're exposed a lot, right? This is one of x-rays is one of the most common ones. We see dental radiograms is one that we do, mammograms as well. So if you have a chest x-ray, that's correct for women. They do that to test for breast cancer. So they basically take a cross section of the breast. They take an x-ray of it to look for any denser spots, because if you have any lumps, they appear a little bit darker because it's harder for light to pass through. Cool. All right, so let's talk about fractures. This here represents a fracture. So notice this bone is not broken, right? It's just in the wrong place. So dislocations are where the bone is misplaced or knocked out of its socket, where it's pulled out from where it is. So notice there's no crack in this bone. It's just in the wrong spot. And if you've ever dislocated something, you know that they may hurt a lot more than fractures because they mess up a lot of things around it. If you have a clean break on your bone, sometimes they just let it heal on its own. But dislocations, you really have to do something with. There's a couple different fractures that we're going to look at. Displaced fractures where the bones don't line up anymore, and ones that do. There's ones that are simple fracture, is where it stays within the skin. Compound fracture is like that nightmare fuel where you see like bones poking out of people's bodies and stuff. That's what we call a compound fracture, where it breaks through the skin surface. And I tried really hard not to find these horrible videos to traumatize you guys with, even though I have a captive audience right now. But so why do some joints? Yeah, so you can crack your knuckles. So you have these tendons that go over your bones, and we'll look a little bit more about how the muscle system works. But you have tendons, and as they go across the bones, they release like little pockets of air. They like it's called Bursay sacs. So as like your bones kind of move across each other, they can create popping and cracking sounds. And that's mostly it's going back into place. So it's like pushing against stuff. You can think of it almost as snapping, right? Why do we get that sound from snapping? It's when we rub two bones together, right, through our skin. But that's the same kind of idea. All right, so we're gonna look here at a short little video. I know that they should have recorded the other way, but pet peeve, right? The vertical videos. I want you to look at, so this is how they would treat an elbow dislocation. So how do we treat a dislocated elbow? We have a fracture, we know we add a cast, but I think this is kind of interesting. I want you to look at this x-ray.
Hi, this is Dr. Anton Foukouri and Dr. Dan Gromis to demonstrate reduction technique in posterior elbow dislocation. One technique is having the patient in prone position. Dr. Gromis will demonstrate where the patient can be in a supine position. What we're doing here is reducing the elbow by pulling down while the gurney acts as countertraction. The olecranon is posterior, and you're pushing down on that olecranon, simultaneously pulling down the forearm. And once you feel that pop, then you maintain the elbow in flexion, put the posterior splint on, and put them back in prone position, and get x-rays thereafter. Again, demonstrating on the x-ray.
All right, what's wrong with this picture? Can you guys feel this x-ray, right? Look at this thing. So yeah, you is right. Yeah, this is real. This is a real x-ray. We're gonna look at some real x-rays too. We can tell, right? This is not a fracture. Nothing is broken, right? This bone is still intact, but it's in the really wrong place. So yeah, and this is one of the problems with dislocations is this will not heal itself, right? Your arm may pop back in like, well, it could, right? If you have movement, but it's not, if you had say like a cut across this bone, it could heal itself because it's in the right spot. But this is the main issue. You have tendons, you have skin, you have muscle, you have a lot of other things that are being stretched and pulled and ripped when this is in the wrong spot. So there's a lot of other trauma that happens, and that's why you get like a lot of swelling as your body tissue starts to break down and your immune system comes in to kind of clean up a little bit. So he's going to talk about what they're doing with this. Let me go back just one sec.
Again, demonstrating on the x-ray. This is the posterior elbow dislocation. The olecranon is posterior, and we're pulling down on the forearm, and it's simultaneously pushing down on the thumb while the gurney is acting as countertraction.
You can imagine this is where the bed is. He's pulling down on the arm. So this whole, I'm grabbing on the screen. This whole arm is going to move down this way, and he's pushing with his thumb on that spot so it moves in. So he's pulling it down and pushing it in at the same time. So that's kind of how we pop stuff back into socket. And a doctor would look at the x-ray and go figure out how the best based off of the first x-ray.
Against the arm.
The alternative approach is basically use your own arm as a fulcrum. Use the patient's arm and your hand as a fulcrum. So they're going to probably be in a position similar to this. You'd supinate their hand, interlock if possible. I've got a long arm, so sometimes this isn't always possible. But interlock or somehow grab their hand, get them supinated, and simply, while using your elbow buried into their biceps, use your arm as a fulcrum to pull up and provide traction. And again, you can assist by applying some olecranon pressure here, coming up this way and bending the arm. And then once it's in, you'll feel the pop, you hear the pop, and you can hold it 90 degrees and provide posterior split.
So my little sister, I think I told you guys before, my little sister is a doctor. She's a plastic surgeon, and a lot of plastic surgeons, they have to deal with especially what she's doing now. She's on rotation, but she says the most satisfying thing ever is to pop someone's like leg back into socket. She's like, it's like the best feel, which I think is kind of nuts, but yeah. So this one, I wanted you guys to get a feel for like the dislocation and kind of how they go about it. Because looking at some of these pictures, it's kind of hard to see some of these dislocations. The fractures are a lot easier to see because when we look at the bones, it's going to be really clear when there's a cut in them. But yeah, let's go and take let's jump into a couple of these, because I think this is probably kind of the coolest thing that we're going to do for this unit for sure. Is okay. So how do you even dislocate a bone? You can imagine if say your arm gets pulled like out of socket. It could be just you have trauma that pulls your arm in a way that it pops out. So it could be so say instead of having like because these are the breaks kind of make sense, right? If we hit hard enough in the middle of a bone, it might break, and that kind of makes sense. But if you hit towards the ends of bones, it might not break here. It just might get knocked out of place. So here, these are kind of the different types of fractures. This is our normal bone. If you know some of these terms, they kind of help you out. So like spiral, we know what a spiral is when it spins, right? So we can see spirals where the bones kind of twist. Transverse is across, oblique is diagonal. So those are kind of where some of this vocab helps us out. So transverse, or where you have a fracture that is just straight across a bone, that's like the most simple. Oblique is diagonal. A spiral, imagine if you had like a bundle of sticks and then you just twisted, right? Imagine if you had a bundle of sticks and you twist it until something breaks. That's what a spiral fracture is. So imagine you like kind of like your body kind of twisted as you fell. You might get something like this. The comminuted is like if you, is it normal for doctors to dislocate babies' shoulders when they're born? I think that might happen So the question was, is it normal for doctors to dislocate babies' shoulders when they're being born? I got to look that up. I know childbirth is pretty traumatic and babies are super flexible. So like we were talking about before, during childbirth, their skull is not fused together. Their skull is a couple of different plates so it can bend. So I know babies' bones and joints are a lot more flexible during childbirth, but I'm curious to see. That's a cool question that I'm going to follow up on. So let me look that up and we'll see what we can come up with. So we have evolution where the ends of bones are broken. Impacted is like, oh, it happened to you. It pops out of place to this day. Huh. So you may have had damage to one of your joints at a young age and it just didn't heal right. That's kind of odd. Some people have looser joints. Some people have looser joints where I have like a buddy that always pop his shoulder out and back in. So some people do have looser joints that are more prone to like dislocations and stuff. So yeah, we have a couple different other parts. A lot of these kind of make sense. I like these pictures because I'm visual. So impacted makes sense to me. Like impacted is, say I jump off my roof and I land standing up, the bones are gonna get squished, right? So it may break from just the force going up and down. A fissure is where you get a crack in the bone. And then the green stick is where you break off part of this bone. And I think it's kind of cool that shows a couple of these causes. So green stick is something that happens in kids because their bones aren't completely hard yet. But some of these causes kind of will make sense judging by the scenario. So if we see a fracture, we're going to try to identify the type of fracture. And I like this picture a lot to kind of show what's going on. All right. So these are some questions to kind of help you out with this. I also have some more directions on the next page. But the basic idea for today is we're going to look at a series of x-rays and try to figure out is it a fracture or is it a dislocation? So is the bone broken or is it dislocated? If it's fractured, how is it fractured? Is it a transverse, oblique, spiral, comminuted, evolution, impacted, fissure, green stick, any of these? So to help us out with this, one thing that they're also going to ask is the axial versus appendicular. Axial, you can think of an axis as a line. So if you draw a center line in your body, that's your axial skeleton. So it's everything that's kind of in the center of your body. Your appendicular skeleton is basically your arms and legs. But included in that is your shoulders and hips. So I like this image here. That's why I included it. This has a couple, some of the bones labeled. What I also included for us today is this interactive map, which I think is pretty helpful. So this will let you highlight any area with this like super 90s animation. But like if you want to find a part of your skeletal system, you can just highlight over this. So this might be something useful for you guys to use as well, because we're going to have to identify what bones are being broken. All right. So here are kind of the directions. This is a simplified version. We're going to use a large picture of x-rays to determine the type of injury. We want to compare the x-ray of the injury to the normal x-ray. So for each patient, we're going to see that they have two x-rays, the patient x-ray and a normal x-ray. And we want to fill out the table. So for each table, we are trying to figure out, are these bones axial, appendicular, or both? What type of fracture do we have? What bones do we have? What's abnormal and what may have caused it? So let's go through the first one together. So this is patient number 1. So if we look at patient number 1, this is a normal forearm. and this is our patient's forearm. So we can pretty clearly see, right? In this case, are we dealing with a dislocation or a fracture? What do you guys think? Did we break a bone or is it out of place? Because this is our normal one, right? Yeah, so we should have a fracture, that's correct. Because normally this is all continuous, it's all one piece. But here we have a fracture, right? And we're looking at the arm. So we have a fracture, and let's look at this fracture. So going back to what we did here, I'm going to switch between these. We have all of these types of fractures. We're going to try to identify which one here best matches the fractures that we have here. So what one would we best describe it? Is it transverse, oblique, spiral, comminuted? So oblique kind of looks like a spiral. So for here, let's see, skateboard fall. Yeah, so let's look at that. So spiral and oblique, both are at an angle, right? I would say either of those would be fine. Either of those would be fine. A spiral maybe because look at how his arm has kind of been twisted, maybe. But yeah, I would say either of those would be okay. So I think we'll go with majority, or we'll do oblique or spiral. So yeah, let's follow these in. So let's go back to our slide. So the fracture type, we said it is a fracture. We can say oblique or spiral fracture. So we have oblique or spiral fracture. We're talking about the arm, right? So let's look at this here to kind of figure out what kind of skeleton we're looking at. So it may be a little bit hard to see here. Let's go to interactive skeleton map. So we're looking at the two bones in the arm. So we want this bone, which is called the ulna, and this bone here, which is called the radius. So these are our two arm bones. So we have our ulna and radius. Those are our two bones that are going to be impacted. So we could fill that in here, all the bones that are present for the break. So we're going to call it the radius and ulna. For our skeleton, are these bones axial, appendicular, or both? We're looking at the arms, right? So if we're looking at the arms are our purple, which would be our appendicular. So we're only looking at the arms. So we classify this as appendicular. So that's the arms only. Okay, cool. So why are these findings abnormal, or what may have caused these abnormalities? So let's go back to our picture. So what's abnormal about this? So obviously it's broken, right? But look at the position of it. So this is kind of our normal position. It looks like it's twisted, right? Yeah, so you can say there's clearly a break at the center of the bone and it's twisted. So what are the abnormal findings? There are two breaks in the center of the bone. And they look twisted. So what may have caused this abnormality? How could someone, and let's look at the patient himself. So it's a 24-year-old male experienced pain after skateboard fall. So how could a skateboard fall have caused this? So think about the way, so this gives you kind of like the background, right? Obviously, yes, he fell, but how would him falling off a skateboard impact his arm? So what may have caused after he fell off the skateboard, what may he have done? I can't talk. So what could he have done after he fell off to cause this break? He tried to catch himself, yeah. So he may have twisted his arm when he tried to catch himself, or tried to break his fall or catch himself. Falling on his arm, he may have hit something. With his arm, like a curb or something. A planter, I don't know if he was, or concrete. Because I'm figuring he's going to be skating like maybe at a skate park or on a street or something like that. So yeah. And for these last two, there's not anything particular that I'm looking for. I want you to look at the X-ray and try to make sense of what you're looking at. So how would you describe that it's abnormal? And what may have caused it? Like, how did the description of what was going on and your X-ray, how do you connect those two? So that's kind of what this last box is just trying to connect what we know about the patient's injury to what we see on the X-ray. And really that's it. We did one together, and that took a while to just kind of get us set up and get the scene set up. To do this though, we're going to be jumping around to a lot of different materials, right? So let's just kind of review where we're getting this. Oh, good question. Axial versus appendicular. It refers to the parts of your skeletal system. So your axial skeleton is the center of your, so in this diagram right here, it's all of them that are just the normal bone color. So it's like the skeleton, the part of your skeleton that's the center of your body. The appendicular skeleton is the part of your skeleton that's like your arms and legs, your limbs on the outside. So you can use this tool here to help you figure out axial versus appendicular. So this slide right here has like all of the stuff that you need. It has the map, so you can find the bones. It has the bigger version of the X-ray, so you can actually do the analysis. And it has the labeled skeleton, so your axial versus appendicular. Cool. So yeah, I figure for today, let's see, we got about 20 minutes. We went through one. We have a total of 1, 2, 3, 4, 5, 6, 7, 13. So 20 minutes today, 50 minutes tomorrow. That's going to be 70 minutes. About 5 minutes apiece. So what I'd say for today, a good point for us to finish is if you guys can get through the first patient 2, 3, and 4, we'll come back together at the last 5 minutes, and we'll talk about any of the ones that we want to go over. But patient 2, patient 3, and patient 4 should be pretty obvious. Patient 4, it's pretty obvious what's wrong with him if we look at the X-ray, right? But that one's my favorite one. Yeah, so we'll have you guys go through patients 2, 3, and 4 today, and then we'll have tomorrow to finish the rest of them.